Good evening to everyone and welcome to today's session. Today we shall discuss thalamus and cerebellum, the two very crucial structures in neuroanatomy, and also we'll have one quiz. Sorry for starting the session little late. We welcome Dr. Harika, Dr. Akhil, Vijay, Akshara, Apurva, Sirisha, Sujata, students in Tirupati, Vizag, Kurnool, etc., etc. So thalamus is the voice, okay? Just check that. Please let me know if the voice is loud and clear. Yeah. Please check if the voice is clear and loud. Alright. Thalamus is the largest division of the diencephalon. So what is diencephalon? We studied, no? Telencephalon, diencephalon, metencephalon, myelencephalon, etc., etc. Now, why thalamus is called thalamus? All the sensory secrets which are reported to the brain will pass through the thalamus. Originally in the Latin, thalamus means bedroom. So that's the reason, since it is the main sensory relay center, it is called as the thalamus. If you look at the diencephalon, what are the various parts of diencephalon? If you can recall it in our earlier discussion. There is one thalamus, there is a hypothalamic area, there is interthalamic adhesion, there is an area which is called epithalamus where the pineal and habenula are located. Then there is a subthalamic area and there is a pituitary. So this is the typical structure of the entire diencephalon. Out of it, the biggest part, the bedroom, is what we are talking, which is called as thalamus. So what is the main function of thalamus? It receives the precortical input. Before sensory cortex receives the sensory input, it receives from all the sensory systems the sensory input. What is the only exception? Olfactory system. Without telling thalamus, we smell the things, right? And it receives the largest input once more from the cerebral cortex back to the thalamus. And it projects mainly to the cerebral cortex, and thalamus, because of its very proximity, also has relationship with hypothalamus and the basal ganglia. Also it will send some fibers. And it plays a very important role in both the sensory and motor integration. For example, if our foot is touching a thorn, that pain sensation is reported to thalamus. Thalamus in turn will tell the motor system that don't further apply pressure on your foot because there is a thorn underneath. So sensory motor coordination is mainly because of it. So whenever we talk thalamus, the most important part of the discussion is what are the various nuclei. So we have medial nuclei, anterior nuclei, lateral nuclei, and internal medullary lamina is the name given for this strip. Then we have a very big nucleus. In fact, the biggest of all nuclei is called pulvinar nucleus. Then we have geniculate bodies, if you see the dorsal surface of it. Then we have a ventral tier and a dorsal tier. So this is the typical structure. Suppose if you cut the thalamus from the front and try to see it, the cross section, what will you see? Typically this is the third ventricle, is the one which is forming the medial boundary of the thalamus. Then we have a external medullary lamina and the internal medullary lamina. And these nuclei within this internal medullary lamina are basically called intralaminar nuclei. Then we have the nuclei located here which are called reticular nuclei. So in summary, what are the various thalamic nuclei? We have anterior nuclei, lateral nuclei which are in turn divided into dorsal tire and ventral tire. We have seen earlier, no? We have got ventral tire and a dorsal tire among the lateral nuclei. In the dorsal tire, we have lateral dorsal, lateral posterior, pulvinar, three important nuclei. Then in the ventral tire, we have ventro-anterior, ventrolateral, ventro-posterior and posterior nucleus. Then we have medial group. In that we have medial dorsal and midline nuclei. Then pulvinar, geniculate bodies. These two are the lateral and medial geniculate bodies. Then we have reticular nuclei, you have seen earlier, and intralaminar we have two intralaminar nuclei which are called centromedian and parafascicular. So that is the general structure. You don't need to remember any of this. Why I am saying that is just to get confidence that okay, I know that there are lateral nuclei, medial nuclei, reticular nuclei, laminar nuclei, pulvinar nucleus, geniculate bodies are parts of thalamus. Just to get an idea, you need to have this part of the slide. But what is very important for you to remember is how these nuclei are important in which ascending pathways. So what are their connections with all those ascending tracks which we have studied? That specific information is very important to be remembered, at least for the exam purpose. So we have very good, we have Dr. Girija, Akshara, Sarvodaya, Sahitya, lot of our students spread across the country. So we have immense video library even hosted on the YouTube in a free way. So it is not organized like what we are organizing it on the website. It contains some of the sample videos. So that will give you a quick idea. So now coming back to our session, specific sensory nuclei, what are they? This table is not there in your notes. If you give everything in the notes, you don't attend the classes, no? We are very commercially minded teachers. So we will force you to attend the class and hide something from the notes. So, okay. This is not there in your notes because I added this table at a little later part of preparation. So you have dorsal column and anterolateral system. You remember, no? Pain is brought by anterolateral and touch vibration by dorsal column. They report that the ventroposterolateral nucleus and ultimately they go to the postcentral gyrus and their main function is somesthesia. You have the trigeminal system. You remember? Trigeminothalamic tract, TTT. What will it do? You have a spinal trigeminal nucleus in the, which part? Pons and medulla, right? In the one of the four nuclei of the trigeminal system. So that sends the fibers and they decussate contralaterally and form a trigeminothalamic tract, which is an ascending tract, and that is the one which reports to the ventroposteromedial nucleus. And that ultimately goes to postcentral gyrus, and that is also important for the somesthesia. Then we have an inferior colliculus, which will be reporting to the, which nucleus in the thalamus? Medial geniculate body. And it ultimately projects to the temporal lobe, where the auditory cortex is located, and it is important for hearing. Then we have the retina, which will be projecting to the lateral geniculate body, and it will be reporting to the visual cortex at the calcrine fissure in the occipital lobe, and it is important for the vision. Then there are certain specific cortical relay nuclei within the thalamus. Among this nuclear group which we have summarized, you have few specific cortical relay nuclei. In the cerebellum, we have ventrolateral nucleus. I mean, the cerebellum will be reporting to ventrolateral nucleus, and that ultimately go to the precentral gyrus motor area and to the frontal cortex, and this is how the cerebellum ultimately helps in movement and motor planning. And which is the nucleus receiving the cerebellar afferents coming? It is the ventrolateral nucleus. Then globus pallidus among the basal ganglia. It will be reporting to ventro-anterior nucleus, and it will be going ultimately to the premotor cortex, and that is important for the motor planning. Then we have few, that's right. Apurva suggested a very good mnemonic to remember. Medial geniculate and lateral geniculate bodies. What is that? M for music, L for light. Lateral geniculate is vision. M for music. Good, good. Our students are themselves experts, doctor. In the process of teaching them for years together, we have incidentally become experts. So I am very happy to know that. So now we are totally changing the look and feel of the website, where every topic is being hosted along with the notes, video and notes. Below that, you can add a lot of your comments, how to remember, how to forget, whatever that you can post as a member, your own comments. So your comments are in turn appreciated by your other classmates. That's how totally 1250 topics into 1250 web pages, each containing a video of that particular topic along with the notes. So along with your comments, that makes a very rich Wikipedia kind of a compendium. That's good. Now, there are certain specific association nuclei which we need to remember. Hypothalamus will be reporting to the anterior nucleus of the thalamus, which will send efferents to the cingulate gyrus in the limbic system, and the main function of it is the limbic activity. Amygdala typically will be reporting to the mediodorsal nucleus, which will be projecting to the prefrontal cortex, and that will also be important for the limbic system. Then hypothalamus and cingulate will be reporting to the lateral dorsal, and that goes to the cingulate, and it is important for all our emotions. So hypothalamus will feel to upset you. Then how will it do? Hypothalamus will tell to the lateral dorsal nucleus in the thalamus, and thalamus in turn will tell that to the cingulate itself, please upset yourself, and we human beings will become upset or become emotional. Then parietal lobe and superior colliculus, they will be communicating to the lateral posterior nucleus, which in turn will project to the parietal cortex, and that is very important for the sensory integration. Suppose if I put a coin in your hand and ask you to close the eyes and tell me what coin or what shape it is, graphesthesia will be there, no? So that ability to perceive the texture, etc., that sensory information is all processed by the parietal lobe. Any parietal lobe dysfunction makes the person to suffer from the loss of ability to appreciate the texture, shape, etc., etc. Then we have an anterolateral system, which will be reporting to the posterior nucleus in the thalamus, which sends efferents to the cingulate, etc., etc., and that's how the pain is being perceived. Then superior colliculus will be reporting to the biggest nucleus of the thalamus. What is that? Pulvinar. And that in turn will report to the temporal, parietal, occipital lobes, and that is typically associated with vision. Then there are certain non-specific nuclei. If you look at the reticular formation will be communicating to all the midline nuclei in the thalamus, and they in turn will send the efferents diffusely to the entire cortex, and that is important for maintaining our cortex alert and awake. See, we say reticular formation in the brainstem is important for remaining aroused and awake. How? Reticular formation communicates to the midline nuclei of the thalamus, which in turn have got diffuse projections to cortex, and they maintain the electrical activity in the brain. So suppose we sleep in a professor's class, problem can stay at how many levels? Either brainstem not working, or your midline thalamic nucleus took a little rest, or maybe your entire cortex is switched off, or you may be busy in Facebook. So anything is possible. Then The basal ganglia, reticular formation and etc. They all have a communication with the interlaminar nuclei of the thalamus, which in turn communicates to the cortex, and that is important for the motor integration between the basal ganglia, the thalamus, cerebral cortex. So that is all the part of the story. So doctor, this is the thalamus which we are talking about. And what is this, doctor? Third ventricle, which is bordering it. Third ventricle is the part of the diencephalon. Then this is the caudate nucleus, and this is the lentiform nucleus. This is the internal capsule. And typically what will happen, doctor? There can be a bleed which can happen into this internal capsule, or there can be a bleed which can occur into thalamus. But a thalamic bleed will be on MRI or a CT horizontally oblong, whereas vertically oblong will be a capsuloganglionic bleed. Why called capsuloganglionic? Because into both internal capsule and also into the basal ganglia, the bleed will be there, is what need to be remembered. These are some of the examples of the fibers. So you have thalamus. Thalamus has one of the biggest nucleus, which is called pulvinar. And here you are having medial and lateral geniculate bodies. And here you are having the globus pallidus and putamen. And typically there can be incoming fibers, outgoing fibers, which are through and through communicating with the thalamus. So once more, summarizing the entire story, quickly we will take up each of these nuclei. We'll come out from the tabular outlook towards learning thalamus into a detailed outlook. Anterior nucleus, what will it be doing, doctor? It receives mainly the hypothalamus, say input will be reached to anterior nucleus of the thalamus. I am trying to talk 2-3 important points about each of these nuclei. First you had a mental picture, which nuclei, what and where are we, right? After having had that, we will try to summarize 2-3 points about each of them. It receives the hypothalamic input from the mammillary nucleus via the mammillothalamic tract. There are mammillary bodies which are the part of, we have seen midbrain, hypothalamus in that area. Then from the hippocampus, the anterior nuclei will be receiving the input via the fornix, and that hippocampal input reaching the anterior nucleus ultimately goes to the cingulate gyrus. So that is how a Pepet's circuit of emotion called as limbic system is being established by the connection between hippocampus to thalamus, thalamus to once more cingulate gyrus, then hypothalamus to through mammillothalamic tract to thalamus, and ultimately thalamus to cingulate gyrus. That's how a Pepet's circuit is being established. So this is an example of how a medial and anterior nucleus group is basically organized, and you can remember that Pepet's circuit, cingulate gyrus, anterior group in the thalamic nuclei are the ones which you need to remember. Then we are having the next important group, which is basically called as the mediodorsal nucleus of the thalamus. So how is it having otherwise called dorsomedial nucleus of thalamus? You have this prefrontal cortex, no? So this dorsomedial nucleus of the thalamus is connected to this prefrontal cortex, and it has got abundant connection with the interlaminar nuclei also. And it receives the input, the mediodorsal nucleus receives the input coming from the temporal cortex, substantia nigra and amygdala. And it is a part of the limbic system and also the striatal system. Striatal system is our basal ganglia system, limbic system is our emotion system. In both of them, the dorsomedial nucleus is basically associated, is what you need to remember. And whenever this dorsomedial nucleus is destroyed, what will happen? Will it be destroyed in any situation? Yes, sir. Wernicke-Korsakoff syndrome, typically it becomes destroyed. And dorsomedial nucleus, because of its extensive connections with the prefrontal cortex and with the amygdala, has got a very important effect on our mood, affect, our emotion and our behavior is what need to be remembered. Then, the next important nucleus are the interlaminar nuclei. Why are they important? Interlaminar receives the input from the reticular formation of the brainstem and other thalamic nuclei, and also very important, it receives the input from spinothalamic, which is bringing pain from the body, and trigeminothalamic, bringing the pain from the face, and it becomes projected diffusely into the neocortex, and it also projects to the dorsomedial nucleus. Then we have a centromedian nucleus. It is the largest of, now we are trying to talk the various interlaminar nuclei. Interlaminar nuclei or intern subtypes are there. We have a centromedian nucleus, which is the largest one. It is reciprocally connected with the motor cortex and also receives input from globus pallidus, and it projects diffusely to the neocortex. Another type of interlaminar nucleus is the parafascicular nucleus, which will be connecting to the supplementary motor cortex. So that is all the importance of this interlaminar nuclei. Ultimately, interlaminar nuclei, one buzzword, if you remember, that's more than enough. What is that, doctor? Interlaminar nuclei are important because they receive the spinothalamic and trigeminothalamic input, which is bringing the pain from our entire body, is what you have to fundamentally remember. Then we have a very important group, which is basically called as lateral nuclear group. In this we have lateral posterior yeah. So what is the importance of the lateral group, doctor? What is lateral group is mainly connected? Once more, it is connected to the visual association area, to the cingulate gyrus, to the somesthetic association area, etc., etc.